We know that over time, COVID antibodies decrease after getting the vaccine or the virus, and now we're learning by how much. The largest study in the world comes from the Texas Biomedical Research Institute and an Italian university, which found antibody levels decrease 50% after 6 months. KXAN's Monica Madden explains what else that study found.
Dr. Brandon Michael Henry is a leading researcher in the world's largest study on COVID-19 antibodies. It tested patients' antibody levels before their first and second doses of the vaccine, and again after 1 month, 2 months, and 6 months.
And we found a number of interesting results.
The first being, women overall had higher antibody levels than men, especially those under the age of 65.
Women tend to do a little bit better with COVID than the men do. And this data reinforces that, is that women do have better immune responses against SARS-CoV-2.
It's the same reason why men tend to experience more severe cases of COVID-19, coming down to a difference in our hormones and genetic makeup.
Estrogen tends to amplify immune responses, whereas testosterone tends to suppress immune responses.
Regardless of how high your antibodies, all adults lose the same amount over the same period of time. There's a difference in the type of antibodies we lose too, which Henry says can explain why we might be seeing more breakthrough cases, but not severe ones.
The antibodies that prevent severe disease, they tend to persist. Those are the ones that dropped about 50% over time. But when we looked at the ones that are, for example, along the respiratory tract that would help stop any type of breakthrough infection, we noticed that about at least 50% of people have no detectable levels of those antibodies at 6 months.
Dr. Henry and other physicians argue this highlights the need for booster shots.
If you haven't had your booster dose, to go ahead and get that. That's going to help us, in preventing breakthrough cases.
And that was Monica Madden reporting. Both Terrytown Pharmacy and Point of Care Health Services tell us they've seen a noticeable uptick in both COVID testing and vaccinations, mostly for children and boosters.